Good afternoon, everyone. Welcome back to Dr. BKM OET classes. And I hope you have seen the videos of listening and reading, which we might discuss if we are left up with some time. But today we are going to talk about OET writing and just to make it very, very easy for you. Trust me, the easiest part in whole of OET is OET writing because you have to score 300. But today we will talk about how to score 350 or 400 or maybe even 450. See, there is no difference between 300 and 450. It's just about how less mistakes we do, data selection, purpose of the letter. Purpose of the letter is the most important thing that we can talk about. Today I have chosen a letter which is very, very big, means it has got more than 400 words, and we have to restrict our words to 200. As you all know, the main thing about OET writing is how to restrict the words, because OET, the best part of OET writing and OET speaking is that you are given everything. You are given, even in speaking, you are given everything, even in writing, you are given everything. But what makes the difference is letter like this. This was something I really wanted to discuss. See this letter, like how big this letter is. So I think you would be able to understand letter having more than, maybe 500 or 400 words, and how to restrict that letter. That is the main challenge we bear when it comes to OET. See the letter. And then you go to the first page. So as always, I will try and cover everything in this video, including whatever I can from the letter point of view. But first of all, I would like to tell you how to start a letter. Always start the letter from the end. So this is my end, because the first thing OET is gonna check about is that whether I have made the purpose of the letter clear or not. So first thing would always be the purpose of the letter. Let's see the purpose of the letter and let's see how we go about it. Okay. Yeah. I'm just going to make it shorter. Okay. So this is the letter. And if I talk about the purpose, first of all, you will be given 45 minutes, out of which 5 minutes you have. In 5 minutes, you just have, they will not give you any pencil because you are not allowed to touch. So you just understand the letter. That is what OET does the best in your favor, that you get 5 minutes to see what is the purpose. So in first 5 minutes, start from here, write a letter referred to the emergency department consultant on duty. Most of the times when OET letter is there and it is going to emergency department, that means the patient is in urgent requirement. So that means what happens in these kind of letter, the last data, that is today's visit or today's information becomes very important, because कुछ तो गड़बड़ हुई होगी. देयर मस्ट बी समथिंग रॉन्ग विद द पेशेंट टुडे, तभी तो हम इमरजेंसी डिपार्टमेंट में भेज रहे हैं. दैट्स वाई वी आर सेंडिंग द पेशेंट टू द इमरजेंसी डिपार्टमेंट. So basically covering that point, it is basically about this thing, that emergency department consultant on duty requesting urgent assessment and management of pericarditis. Pericarditis. So pericarditis is the condition that has happened. So we need urgent assessment and management. Write a letter to Newtown Hospital. So if I have to prepare the first paragraph, let's make the first paragraph easiest. So I'm just going to write it over here in front of you, and please try to follow these things just to make it comfortable for yourself and make it easy for yourself. Okay. So if I have to write just first paragraph is the main paragraph. This letter is being written regarding Mrs. or MS Y, whatever the name of the patient would be, who requires urgent. Now I don't care how big the letter was, whether it was tough letter or easy letter. This is the first thing to assure my 300 marks. Who requires urgent assessment and management for pericarditis. Even if I write this much, this is more than enough, at least to tell the purpose. So this letter is being written who require this and this thing. Therefore, she is being referred under your expertise on urgent basis. She is being referred under your expertise, because we are sending to expertise on urgent basis. So you don't have to write experts in all the things, and main things are commas and connectors. So if you can see, I wrote this Mrs. Y, then I use the connector who, comma who requires it. And if you will see first paragraph, which makes around 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, plus 11, 22, plus around 10 words maybe, so around 30 to 35 words. See, total letter is only 200 words. You can well understand that in OET, the only confusion of writing can be how to concise the data. उसको कम कैसे करना है, brief कैसे करना है. That is the only trouble we can have. So, 330 words तो हमने लिख भी दिए, या 35. So बचे कितने? 50 plus 50 plus 65. Total 200. 50 plus 50 plus 50 plus 4 paragraphs. 50, 50, 50, 50. फर्स्ट पैराग्राफ तो हमने लिख भी दिया, और देखो हम पास भी हो गए, 300 मार्क्स यहीं पे सिक्योर हो गए. इतना सिंपल. सो रादर देन गेटिंग कंफ्यूज्ड एंड गेटिंग वरीड अबाउट इट, मेक इट सिंपल. नाउ लेट्स टेक इट फॉरवर्ड. अब हम चलते हैं इसके अलावा और हमें क्या करना है ओईटी के लेटर्स में. तो अभी के लिए मैं इसको सेव कर लेता हूं अपने पास, सो दैट आई डोंट लूज इट. एंड अब मैं पढ़ता हूं लेटर को. अब इस केस में मैं वैसे तो लेटर को स्टार्ट से पढ़ना चाहता हूं, पर मैं ये चाहता हूँ, आई अंडरस्टैंड, आई एम सेंडिंग इट टू एक्सपर्ट्स. माई मेन प्रॉब्लम इज दिस, दैट इज वट यू नीड टू अंडरस्टैंड. दिस इज द मेन प्रॉब्लम. Shortness of breath, chest pain, frustrated with progress, recovery, and all that stuff. This is my main data. Medication adherence, reports compliance, regular blood glucose monitoring. So that means if we are writing about blood glucose, that means we have to tell about the diabetes mellitus. So the first paragraph is about purpose. Second paragraph is social history and medical history. Whenever there is emergency care or urgent care, most of the time social history will not be required. Everybody understand? Emergency department mein who will require social history? So second paragraph, medical history in this case. Third paragraph, what we have done. So majorly would be this. And fourth paragraph, what we need is this, again the purpose of letter in detailed form. So maybe fourth paragraph I can use this one as well. This will be my fourth paragraph. Third paragraph I will try to include whatever is possible. So that is where again I would like to show how big this letter is, because we might have forgotten by now why we are paying attention. This is the letter, this is the second page, and this is the first page. So we've got humongous data. So that is what confuses us in OET exam कि इतने सारे डाटा को how would we cover. But that is what I am here for, to guide you to do that. Again, first paragraph is done. So yeah, you can watch the video from the start अगर आप YouTube पे देखोगे जब ये वीडियो. तो अब करते हैं 30th August 2019. लास्ट डेट इज टूडेज डेट. सो अब देखते हैं टुडे में क्या क्या हुआ है. टुडे में एज वी सेड, patient unhappy, reports feeling chest pain, relieved by sitting up, shortness of breath, frustrated with the progress of recovery. So that means maybe he was trying to recover, but there is no recovery. Medication adherence he did. Temperature is this much. We will write this. Temperature is this. Respiratory rate is anything that is abnormal. Mention it. Because urgent emergency department would be requiring this data. 28 respiratory rate. Temperature is high. Heart rate is 115. It should be around 60 to 72. Then if you blood pressure is little less than usual, because normally is 140 by 90, it is decreased. So there is kind of hypotension as well. So niece no longer staying overnight, work commitments in the Green Valley. So there must be something about the niece. Maybe the niece was staying with her, but now she is not staying. Patient unwell, nil improvement. Obviously there is no improvement. Relapse of complications of pericarditis. So whenever there is any question mark, if you can notice this question mark, guys, this question mark means suspected with. Never write diagnosed with. So the main assessment is there is a relapse or complications of pericarditis. There is relapse or complications of pericarditis. Organize urgent hospital transfer to Newtown Hospital, which we have done. तो हमें ये mention करने की जरूरत नहीं है. Write a referral to the emergency department, include medications, patient history, and test or observations. ये तो हम वैसे भी, otherwise also we would have done that. because this is what OET letter is all about. So this last plan is not very important because I obviously will write in the OET letter. Now the first paragraph what I created, I will try to write it again. Okay, so this is here. This is what we wrote in the first paragraph. So I will drag it down so that everybody can see it. Okay. Now pericarditis, otherwise I mentioned, and relapse or complications of pericarditis who requires urgent assessment. Now the only line I can add as she is suspected with either word is very important. Whenever there is suspected means always two things, either relapse or complications of pericarditis. Now my first paragraph is totally fine. Now if you can see this first paragraph, all of you should like it more. This letter is being written regarding Mrs. Y, who requires urgent assessment and management for pericarditis क्योंकि she is suspected with either relapse or complications of pericarditis. Therefore, she is being referred under your expertise on urgent basis. Now, this makes even better. But even if we don't write it, that doesn't mean that you will not get 300 marks. But again, now there is usage of another connector. So connectors give you marks as means because. So comma as connect, you will put comma before the connector. I hope everybody is understanding and everybody can understand this in a very nice way. I will make it darker so that you can see it. This letter is being written regarding Mrs. Y. This paragraph is fine. You are marching towards 350, 400, 450 scores. So that is what we need. Now I have to restrict the data. So last visit I have seen. Now I will go to the first page because ultimately I want to understand what patient is having because I will be able to write the letter in a nice way if I understand the patient, so that these things are done in 5 minutes, but you can take even 10 minutes, not a problem in the file. If I would have been alone, तो अभी तक मैंने क्या किया? I have just taken 5 to 10 minutes in a way. Patient is having pericarditis. She is either having relapse or having complications of pericarditis because I am not sure. I am a nurse and I'm sending it to you on urgent basis. And this is the main thing I have written. Now I would like to read more about the patient. You are a nurse conducting a nurse home visit as a part of routine follow-up care after this patient recent hospital discharge. Now I get to know there was a recent history of hospitalization. So hospitalization of the patient was there recently. One thing done. Name is Mrs. Styles. So where I wrote Mrs. Y, generally saying where I wrote Mrs. Y, I will write Mrs. Styles. MS Styles. Now this makes more sense. I will again make it darker for you. So everybody can understand it. Very easy, very simple. First paragraph is all done. Now let's move forward with our pencil. All right, let's go forward. So now Mrs. Tyler, 62 years of age, we will mention it over on the above. As you know the pattern of OET, if you don't know, so there are other videos of ours of Dr. BKM you can follow. Today I want to talk about purpose, connectors, grammar. So if you have noticed one grammar point in this, then this is another thing that I want to mention. As she is suspected with, you can also write has been suspected. So this will make it even more charming. Has been means just now. That is why I have sent it on urgent basis. If by chance even you write this as who is suspected, there is no problem. But has been looks better. So this letter is being written regarding Mrs. Style who requires urgent assessment and management as she has been. This also I will tell you why has been. Otherwise you will get confused, but note the grammar, connectors and everything. I hope it is visible to everyone and it makes sense to everyone. Let me cross check it. I hope it is visible to everyone guys. किसी को भी कोई डाउट तो नहीं है? आप चैट बॉक्स में प्लीज एक बार छोटा सा मुझे डाल दो that I am going in the right direction. If everybody is okay in the chat box. Visible to everyone? Hmm? Yes, okay. Thank you, Priya ma'am, for putting it on the chat box. Okay, Parvinder ma'am. Thank you, Sumaira. Thank you, Tahira. Thank you, thank you, thank you. Okay, so it's getting fine. Thank you for your response. Now let's take it further. Okay. So now data selection. So this I have picked up name. Age I will already write in the pattern, so that is fine. Primary teacher na lives her own can write so, but it is not important for urgent again. Husband died 3 years ago, lung cancer, she is living alone. Now this looks very important. She's alone, she does not have any, that's why maybe her niece was coming to take care of her. But again, we can't write everything. So just take it easy, relax, and write only the things which are required. Now, hypertension diagnosed in 2011. 2013, moderate hypertension, commenced this drug, quinapil. So you all know it's kind of an ACE inhibitor, but yeah, we don't have to talk about this in OET. Regular monitoring, currently well managed at around 140/90. So normally her BP is manageable, but if you remember the today visit, her BP was down 125/78. So normally she manages well, but today she is hypotensive as well. So that was the important takeaway point. So diabetes mellitus 2013. So hypertension 2011, 2013 she was found with diabetes mellitus, oral hypoglycemics, well managed. So don't overread it. If you will overread it, it will trouble you. So don't overread it. Just go through it because you are reading for the first time in the final exam. तो मैं भी बस ऐसे कर रहा हूँ. Hypertension, diabetes mellitus, okay. Depression 2016 triggered by the death of husband, requires counseling since 2000 July. Otherwise, very important but urgent assessment, pericarditis, out. Hypertension and diabetes, I would like to mention. So if I have to write a second paragraph by chance, and let's see more medical history. There is some more medical history that has been given. Family history, mother died of hypertension and diabetes mellitus. Again, important, very important. You can mention it if you would like. Writing one line is not a problem because we don't want to reach to 250 words. 250 words is troublesome, maximum 220. Otherwise, they say 180 to 200. But I would say maximum 220. Please, 250 you still can pass if you have written the grammar well, if you have told the purpose well. So why so many people score writing 320, 300? Why? Because even after watching our videos, sometimes they don't realize that they have crossed 220 words. So that is why people are getting C positive. C positive is pass, I know. But why are you getting only C positive when you all are doing the same hard work? Grammar is good. Why C positive? That means your word count went crazy. So to get at least C positive, purpose of the letter should be clear. Word count should be maximum 220. If more than 220, it's danger. And grammar should be correct to pass. But if you restrict your words, tell the purpose nicely, grammar, the same letter becomes 450. So it's all about how do we execute it. So out of this data, I'm picking only two data, hypertension, diabetes, and maximum mother, but again, pericarditis की urgent treatment देनी है. So still I don't feel any much need. But if I have to write, I will write in the last. Anything that you are not sure, leave it in OET. In the last paragraph, last line, when you will be writing the last line, you say, please note. In the last, please note, her mother also had hypertension and diabetes mellitus. If by chance there is any confusion about any data, try to restrict your words, write it in the last. So done. So we can always write it in the last. So this is not required for us for now. Done. Now lifestyle, smoke, non-smoker, 1 to 2 glass of wines, walks dogs 20 minutes, ongoing counseling, diabetes management to maintain balanced diet. Again, there is nothing special, urgent care, not special, and also there is nothing noticeable. Medications she's taking, I want to write the medications, but I will try to enclose it in the last line of the letter. Ki, this is this girl, this a person have 62-year-old, that these medications are being enclosed. How do you write this line? This medicine line? Medication chart is being enclosed with the letter. So don't overwrite the medications. This would be the last line. Medication chart is being enclosed with the letter. Sorry, I will correct the spelling. But again, my major focus is to tell you about the data. So you can write it in the last that when in the last we write, therefore she is being referred under your expertise. Please note medication chart is being enclosed with the letter. You can enclose it so you can save your word count. If there is any important medication or it is a hypersensitivity reaction, means kind of out of the medications, then you can write it. Otherwise, why to mention? Don't mention, because it will increase your data unnecessarily. Now this page is the main page because urgent means recent incidents, what has happened, recent incidents. So if I go through the recent incidents, 23rd August, that's why I'm saving my data. So the only takeaway in the social history or in the medical history was diabetes mellitus and hypertension, for which she is taking medication. That's the only data I have taken from the first page. That's it. Nothing else. The calmer I am, OET writing stronger candidate means having dared to leave the data, which is insignificant. So first be clear in your purpose that how to do OET writing. Easy, less the better. Any line that is confusing, don't write. Sometimes the only mistake candidates commit is that they write something which they don't understand. Please don't write it. If you just want 300, even if by chance it is important line, by chance you miss it because you were confused, still you might pass. But if you write something wrong, then you have given evidence to the examiner that I did not understand. Chances of failure becomes more. These are the most important instructions in OET writing. Write less, write only what you are sure of. Very two important instruction. ज़्यादा है तो कम करो और मतलब मुश्किल है तो छोड़ दो. ठीक है, ज़्यादा है तो तोड़ दो, मुश्किल है तो छोड़ दो. ओईटी का एक ही असूल है. दैट इज द ओनली फंडामेंटल ऑफ ओईटी. लेट्स मूव फॉरवर्ड. देखो अभी तक हम लेटर कितने आराम से लिख रहे हैं एंड देर इज नो प्रॉब्लम एट ऑल. है ना. नाउ लेट्स सी. पेशेंट विजिटिंग 23rd August. टुडे इज 30th. सो ऑलवेज रिलेट. टुडे इज 30th. Yeah, this is today's date. So that means you can understand 7 days ago. On 23rd August 2019, patient visiting sister for weekend. Sister lives 3 hours away from the Newtown Green Valley. So that means patient lives in Green Valley. Obviously, we understand until now. And that is why patient was living in Green Valley. That's why we are sending the patient to Green Valley, Newtown only. है ना, Newtown. That means the patient is a resident in foreign countries. It's not like that I will go to this hospital. So whatever the nearest hospital is, you go to that emergency department. So because all the medical practices are standard, so there is not like this is a good doctor, this obviously there must be, but still it's not like us that this is the best hospital, this is not. So if patient is living in Newtown, most probably he will go to Newtown. Simple. These are also simple things you must know. At least your fundamentals should be clear. So now the patient was traveling, patient admitted to Green Valley Hospital late evening with fever, sharp pleuritic chest pain, worse on breathing, general weakness, malaise and tachycardia. So she was having high heartbeat rate, there was kind of a chest pain, fever was there. So patient was admitted. Now see the next day. Next day, her vital signs were again respiratory rate. It's almost the same. Respiratory rate elevated. Blood pressure was higher though, but if you will check the diastolic, it was little lower. So yeah, it's still persistent with this kind of a blood pressure. Temperature higher, heart rate high. But if you see the lower condition, today's condition is even more critical because respiratory rate and all that, and even temperature was higher in this case though. But yeah, otherwise both are critical, but heart rate is very fast over here it was 98, so it's kind of similar. Yeah. So basically when she went in this Green Valley Hospital 7 days ago, these tests were conducted and she was found with, again in the past whenever you write, so you write passive voice, she was found with. That I have told you in all my videos. And if it comes in today's visit, then you say she has been found with. Whenever anything is done by the hospital, that is by us, whether second hospital or any other hospital, it always come passive voice, was plus third form. She was found with. So she was found with high ESR, CRP, and also elevated WCC. So all the thing will come in one line. And she was found with. So 7 days ago she was admitted due to, so I will write 7 days ago she was admitted due to this thing and she was found with. So I will try to again make the data more concise. Concise means brief, brief means chota. So I will just write one line. On 23rd August, she was admitted due to these symptoms. On examination, she was found with these. Viral influenza type B was conducted and echocardiogram ECG showed pericarditis. So this I can write simply in active. ECG showed pericarditis. So active, that is the difference between active and passive. So ECG showed pericarditis. I will tell you about active and passive now. ECG showed, if I want to write passive, pericarditis was shown, or I can use a better word, revealed by ECG. That is the only difference between active. ECG showed pericarditis or pericarditis was revealed by ECG. Or you can write in ECG or via ECG. Simple. Okay. So, or even if you don't want to write ECG, pericarditis was revealed or she was found with pericarditis. You can write anything. Best and simple, ECG showed pericarditis. Yeah, revealed. Now this is looking the best. So I will try to use whatever is suiting to the atmosphere. So if you can see, this is very much suitable, pericarditis. So that is the main diagnosis of the patient. I can't miss this. So patient was given IV saline and ibuprofen. Evaluation, she was assessed with viral influenza type B plus pericarditis. On 25th, patient was discharged, and because we have given the treatment after this, but what I will try and do is I will try to write this after this and this after that. This treatment was given and then she was discharged on 25th. So she stayed in the hospital for 3 days, 23, 24, 25. 25 she was discharged and niece drove over and stayed there for 3 nights. तो niece उसके साथ 3 दिन रही, followed by the nurse home visit arranged for 30th August. So we are the nurses and we arranged a follow-up visit. Home visit 30th August 2019. Done. Patient today. Now today the patient is unhappy and she has reported. So now whenever you are writing these things, so you will write in the present. Now I will tell you about the present tense. In the past, you used ECG showed or was passive was revealed. And when you are writing in today's visit, then you write, okay, I will write it for you so that you don't get confused. Active ECG showed. That is how you write in the passive voice. Past. Pericarditis. And if you want to write passive voice, and she was found with, or you can write, or she was found with pericarditis. Both are correct. Both are absolutely same and there is no problem. Whatever you want to write. Just remember one thing, active second form, passive voice. If this is today visit, then I just have to change one thing. Today, ECG has showed, it is present, and when it becomes passive, it becomes has been. This is the only thing you need to remember. So now if I write today, patient has reported actively. Today, the patient has reported, so same lines, has reported chest pain, which is relieved by sitting with this sitting, along with, that is how you use connector, shortness of breath and fatigue. That is how you write the last paragraph. So I'm also writing the last paragraph for you. Today, the patient has reported chest pain along with shortness of breath and fatigue. This is the main paragraph, so that's why I'm writing it in front of you. And then you will say, what else? Frustrated with the recovery, adherence. Adherence was good, frustrated, that is not important. And vital signs, low grade fever. She She has in the present, sorry, she has. In the past, I would have written had. Now she has a temperature of 38.1 along with is a very nice connector, along with, because it goes in a flow without any commas, along with elevated respiratory rate of 28. RR should be capital of 28, and heart rate, everything is coming in one line, heart rate of 115. Her BP has been found. Now I am showing strength to the examiner of my passive voice. Has been found to be 125 by 78 mm of He. They have not given unit, but we know it, so we will write it. And patient is unwell. ये तो लिखने की जरूरत नहीं है. So now what we can understand, just a second, I want to write everything together. Sorry, I have to mix it up. Oh, where has it gone? Oh, it has recorded something wrong. Okay, I think that has been missed. That I will write the first paragraph again. Why to get confused? So I'm taking this only. Okay. Covering this. So now I will see if it is copy pasting in the right way. If it does not, no, it's not. Today, yeah, it is copy pasting in the right way. Sorry. Yeah. So I'm writing it here. Today the patient has reported chest pain with shortness of breath. Spelling please ठीक रखना है पेपर में. Spelling के भी marks कटते हैं. You all know that. Her BP has been found to be this. This. Now she requires your urgent expertise as she has been suspected. This is the only line that will repeat in OET. Suspected with relapse or complication of OET. Complication of pericarditis. So this is the last paragraph. Test done for the day. This is the complete letter you will write. This is the last paragraph, and therefore now if anything is missing, you can write please note. Her mother also had this if you want to write, but this is not required in this, so I'm not writing. Please note that medication chart. Further, in addition is also a good connector. In addition, so always use connector like further. In addition, don't use any other connectors. Again, we have got a complete video of connectors. I will post it here so you can see that video as well. But in addition, medication chart is being enclosed. Otherwise, it is not looking very nice. So even if you don't write, even then, medication chart is also being enclosed. Also, never start a sentence with also. So also should always be in the middle. Medication chart is also being enclosed with the letter. This is the last paragraph and it's completely done. There you go. This is the last paragraph. And if I have to write the first paragraph, let me write it over here. Again, this letter. Yeah, I'm writing this. I'm writing, even I can write this way. I'm writing. This looks rather more interesting what I would be writing now. I will try to write it in a clear page so that you can see it this way. Now, even if I have to write this letter without looking at anything, let's see how much time does it take. Okay. Whiteboard. I'm just taking this whiteboard for the convenience. Give me just 1 second. There you go. I hope everybody can see the whiteboard. Is it visible to everyone? Okay. I will read it from the chart box and let's see normally OET letter, how much time does it take? Just 1 second. Sorry, guys. Okay, whiteboard is visible. Okay, cool. Now let's see the complete letter. How much time does it take? Otherwise, I'm writing side by side as well. But generally to tell you, if you understand the letter in the best possible way, how much time does it take? Let's see. And I'm typing it. You will be writing with your pencil, which would be faster. I'm writing to refer, generally saying refer Mrs. Alicia or whatever the name was, Mrs. Tracy or whatever the name was, sorry. I'm not going back because then I have to shuffle everything. Tracy, who has been suspected with either relapse or what was the word? Relapse or complications. As she was not important, I have forgot that. So yeah, pericarditis. Therefore, she is being referred under your expertise. There was something like we written at that point of time that will come in your video. But again, I told you whether you write it or not, that is not that much important. As she has been suspect, she has been diagnosed with, who has been suspected with this. इसमें we have covered this point in rather with less words. Complications. So there is nothing right, nothing wrong. It's just about you write in the best possible. First paragraph is all good, this much. Okay. And I have restricted my word count as well. Second paragraph. Mrs. Stanley or whatever the name is a known case of diabetes mellitus and hypertension for which she is on regular medication. This is the data you would require. She is on regular medications. This is the overall letter that you want to write. Also, her mother also had history of had hypertension and diabetes mellitus, but again, it is not important. Still, I am writing it just for that. Even if you write it, one line will not make any difference. Then on 23rd August, this was the main data, 2019. That is how you write. If you want to write exact, that is how you write. On 23rd, A capital, August 2019, uh, she was found, she was admitted to Green Valley Hospital. Don't write sister के पास गई, nothing. Due to high fever and this along with phlegmy. No commas, nothing. Just a second. Along with whatever other readings were, like along with due to high fever and elevated respiratory rate and heart rate, HR. Okay. So on examination, always write OET letter like this. She was found with जो finding थी आपकी. She was found with this and this thing. At that time, this is one of the best thing I can teach you. At that time, she was diagnosed with, or she was assessed with. If you're not sure whether to write diagnosed or suspected, always use assessed. She was suspected with influenza type B, whatever viral, and pericarditis. Or you can and pericarditis was revealed by ECG. That's it. Done. This paragraph is all done. And then we gave the treatment. Therefore, she was given IV saline. So this is how simple that I don't have to even look. Just one or two times I would have to look. But if I've read it well, then I don't have to write, reconsider these things. IV saline and one more thing was given, ibuprofen. This much. On 23rd, that means after this, on 25th August, she was discharged. Simple. She was discharged and was advised for self-care. That's it. Today, now this is the main thing. She has been visited. This is the main thing again. Passive voice, she has been visited by us. Passive voice means I went to her home. Today she has been visited and and she has been visited and has been found with similar signs, this will make examiner even more happy. Similar signs such as, never write like, always use the word like, such as elevated temperature and elevated and increased HR and RR. Of course, you will write complete. I just have to write it for you. That's done. Letter is all done. Uh, on the basis of these, always make variations on the basis of these signs and symptoms. She is suspected with, just a second. She is suspected with either relapse or complications of pericarditis. This is how you write. Letter is all complete, and now we will do the word count as well. Please note, medication chart is being enclosed with the letter. Again, please note, if it's not looking nice, try to change it. Just make it medication chart is also being enclosed. This is more fluent. So that is, connectors are used according to whether it's suiting or not, enclosed with the letter. Your urgent assessment and management for pericarditis would be highly appreciated. Urgent word is very important. Even if sometimes you feel like it's not suiting, that would be highly appreciated. Your urgent assessment and management for it is highly required. So if you're not liking appreciated is not looking nice, then don't write it. This is the complete letter. And see, I did not take even 5 to 10 minutes. That is what I'm saying. Even if you are writing, but don't make it like, please listen to this carefully. So even if you want to think around 10 to 15 minutes to plan your letter, if you have practiced OET letter with Dr. BKM institutes, like if you are a part of Dr. BKM, if you have planned it very well, then it's not a problem. You can start even after like 10-12 minutes, but try to understand the purpose, because if purpose is right, you will pass. If purpose is wrong, then we are in trouble. So first paragraph, comparatively less data, tell the main thing. And whenever suspected word is there, either or can be a good option. But if you don't want to use it 2 times, so you can just write with the relapse. But always say or. Or word is very important in suspected. Never say suspected with, in this it's easy, relapse or complication. We can say suspected with relapse and complication. But and word is never good. Suspected with either this or this. Suspected word question mark always comes with the word or. Never write, because sometimes it would be, suppose, these similar symptoms can be in COPD as well. So sometimes it would be question mark, pericarditis or COPD. So you can't say she is suspected with pericarditis and COPD. And nahi, or. It is either this or this. So that is what you need to understand in case of suspected. So this is the whole letter in front of you. Of course, you have to make the spellings and everything correct. So this is the letter. And this much is the only letter that will go, because if you will add any line to it, it will go beyond reach. So that is what you need to understand. That you have to understand the letter, make a lovely story, and write it in a fluent handwriting. So this is the fluent handwriting that I would love to mention. That I'm writing to refer Mrs. Tracy, who has been suspected with, therefore she's being referred under your expertise. Case of hypertension for which she is taking medication, connectors ka use, and uh, and it has been well controlled normally. If you want to add some line like this, rather than mother, normally both her conditions are well controlled as she is well compliant with her regime and medications. So this would have been more important than mother. So this is better. So this is like again is a known case of diabetes for which she is on regular medications. Normally, both her conditions are well controlled as she is well compliant with her regime and medications. On August, she was admitted to this at that time. So this is the different connector, and it is a basic connector that makes at that time. That means 4 days ago, 7 days ago, she was assessed with this, and which was revealed by, therefore, she was given this. On 25th, she was discharged. If you want to write some other word as well, because it was the next day, so you can also write next day. Better next day की जगह अच्छा क्या लगता है? The following day. The following day is a very nice word. The following day, that means on 23rd, she was admitted. The following day, she was assessed with this. This treatment was given. On 25th, she was discharged and advised for the self care. Today, she has been visited, has been found with similar signs such as elevated this. On the basis of these signs and symptoms, so again, a variation. And then medication chart is being enclosed with the letter. Your urgent assessment for is highly required. So this is how you write an OET letter, and I hope you all have understood it in a very nice way. So I'm just going to pause this recording and will ask you how was it and whether you understood or not how to make big letter comparatively little more precise and concise. Thank you guys. Subscribe this channel and share with your friends. I am also developing this habit of saying so. Okay, thank you.